Good afternoon. Welcome to Medical Grand Rounds. I'm Bob Wachter, Chair of the Department of Medicine. Just a little housekeeping before we get started here. There's the usual instructions here. I think you probably all know them by now. If you have questions, type them in the Q&A. We'll try to get to some of them. There is closed captioning available, and we will post this tonight on YouTube as we've done for the entire series with now more than 2 million visits. Before I start, I wanted to thank our production team. I usually do this in the end, but you should see all of them and meet all of them. This is Alyssa Tecklenburg, Serena Soy, Lisa Tran, Maria Novalera. I don't think Maria's on. Kyle Van Auker, John Tess, Quinny Chang, who minds the questions. For the entire team, they have been absolutely magnificent. I did not warn them 15 months ago that they'd be spending a huge amount of time putting these together. We did it on the fly. I select the speakers a couple of days in advance, so it's definitely a fire drill. We've had our share of Zoom incidents along the way, but they have produced this series magnificently well and reliably, and they've educated a lot of people, and so I'm really grateful. Thanks to all of you. Just the way we're going to do the next couple of months, we have one more Grand Rounds non-COVID next week on climate change and health, and then we're planning on taking July and August off, and we will resume Grand Rounds after Labor Day. Obviously, if there's a lot of stuff happening in COVID, we will come on with a special Grand Rounds during the summer, but that is the plan. That's what we usually do. And when we come back after Labor Day, we're going to retool Grand Rounds. Obviously, we've learned a lot of lessons here. I think September is going to be virtual only, and then starting in October, likely to be hybrid, where we'll do it in person for those that want sandwiches or burritos and to be there in person, but also have a virtual option. So more about that over time, but this will be, for now, the last formal COVID Grand Rounds in this series. We've done more than 50 of them. So today there will be two segments. The first will be quite familiar, a brief update on the pandemic from George Rutherford, with a focus on the Delta variant, what it means to all of us. I'm not going to waste any time introducing George because I've done this maybe 30 times over the past year. George, of course, has educated all of us about infectious disease epidemiology and has been on these Grand Rounds many, many times and has been absolutely wonderful. So let me give it to George. George will be on for about 10 minutes or so, a couple of minutes for Q&A, and then the bulk of the session will be me chatting with Andy Slavitt. So George, let me hand it over to you.
Thanks very much, Bob. Right now, worldwide, we're seeing a decline in cases, which has really been because the cases in India have contracted along with cases in Europe at the same time. Right now, India had about 2/3 of a million cases last week, but then the next 4 were all in the Western Hemisphere: Brazil, Argentina, Colombia, and the U.S. And then Chile is also here in the Western Hemisphere. I'm going to spend some time today and talk a little bit about the United Kingdom, which has, and I put it up here, you can see that they've done really well recently, but have an uptick, which is part of a kind of a complicated mix of questions about vaccine policy and variants. So we'll go there. So here's the UK. They're really probably entering a third surge, which is mostly right now in the Midlands and the North. And this is the Alpha variant, which we used to call the UK variant, which we used to call B.1.1.7, has been displaced by a more transmissible Delta variant, which was originally described in India, also called the B.1.617.2 variant. And currently 90% of the cases in England are caused by the Delta variant. Here's a graph from Scotland, where you can see the emergence of the Delta variant here and the contraction of the Alpha variant. 63% of the population of the United Kingdom, this includes Wales and Northern Ireland as well, has received 1 or more doses of vaccine. 45% have been fully vaccinated. As best we can tell, it's not really well publicized, is that about 30% of these are Pfizer and about 70% are AstraZeneca. And currently they're vaccinating anyone who's 21 years old and older and are really working through a second round of vaccines. This policy of focusing on the oldest people first and then kind of working down has created a large unimmunized population. Some of them may have natural immunity, but it's largely probably non-immune, which seems to be sustaining a lot of this because much of the incident infection is in people under 24 years of age. They've had a small increase in hospitalizations, but not in deaths as of yet. However, Boris Johnson delayed reopening for one more month to July 19 to give more time for vaccines to catch up. But as far as I can tell, and if others know, please correct me, the schools are open and continue to be open. Here in the U.S., we're approaching, we have crossed 600,000 deaths, which is 6 times more than Dr. Fauci said gloomily more than a year ago. And almost 33.5 million cases. We're declining in cases, hospitalizations, and thankfully deaths. In California, we're really leveling out here at around, it's somewhere around 800, 900 cases reported a day. Hospitalizations continue to fall and deaths kind of bounce up and down. We had 28 deaths yesterday from COVID in the state. If we look across how we're doing relative to other states, we're still quite in the vanguard of states that are doing really well. We're about 5th on the list. Vermont leads the nation with 7.1 cases per 100,000 in the last 7 days, over the last total of 7 days. And then South Dakota. You'll see that most of these are highly, like Vermont, for instance, the New England states, Maryland, Virginia, California are highly immunized states. How South Dakota got into here, they actually had a kind of a unique vaccination program and probably have a fair amount of immunity, both from vaccine-acquired immunity as well as naturally acquired immunity. The states that aren't doing well are here: Wyoming, Missouri, Colorado, Utah, the kind of central cluster here, Florida, and then poor Nevada has also shown up on this list, and Washington can't quite shake it for whatever reason. But all of these, with the exception of Missouri, Utah, and Arkansas and Nevada, have declining case counts. But you can see this is suggests that there's some sort of outbreak going on here in Arkansas. These are per 100,000. These are daily, and these things over here are per week. So just so you have the basis for comparison. Here in California, we've vaccinated. We have more than 39 million vaccinations that have been administered, and we're averaging over 100,000 a day still. So I guess the lottery's working. 56.6% of Californians have received 1 dose, and 47.7% have been fully vaccinated. San Francisco is really doing really well with 73.2% of, this is of everybody, not the eligibles, of everybody, with 1 or more doses, and 64.5% fully vaccinated. We're continuing to use predominantly the Pfizer vaccine, then followed by Moderna, and then a small amount of Johnson & Johnson. If we look by counties, 1, 2, 3, 4, 5, 6, 7, 8 of the 9 Bay Area counties are in the top 10. The other one, Solano, is lagging behind and looks more like some of the Central Valley counties than the Bay Area counties. But even Sonoma, heavily agricultural county, still has 55.8% of the population vaccinated, plus a lot of people with naturally acquired immunity. There is lagging by race that still goes on, and this also, you could put these data by census tract indices as well, and the poor census tracts are catching up still, but there are still substantial chunks of our African American, Latinx, and Native American populations that remain unimmunized. Whites and Asians are doing better, but it's still not perfect. A lot of this lag is because we're just kind of catching up now with younger people, especially in the 12 to 17-year-old age group. Overall, for 65 and plus, there are only 11% who've been unvaccinated. And if you have patients who are in this category, I would ask you to inquire about their vaccination status and to see what can be done in order to get them vaccinated. Now, we talk a lot about immunity, and I think it's important to realize that there are parts of the state, take Lassen County as an example, where they've had high rates of, there are high rates of cases, which means there's probably high rates of naturally acquired immunity. And they also, at the same time, they have very low rates of vaccination. And so, worrying about outbreaks in Lassen County, yeah, sure, there's unvaccinated, they're probably non-immune people, but the immunity gives you a big background, kind of a big starting point in terms of an immune population. And that's true in Kings and Kern County, and then in the big populous Southern California counties, Los Angeles, San Bernardino, Riverside, and then in some of the more agricultural ones like Ventura and Imperial. So together with high immunization rates in some counties, especially up here in the Bay Area, and then high background rates of immunity in other parts, and a kind of an in-between combination, for instance, here in San Luis Obispo, where it's, the San Luis Obispo, where there's kind of a medium high level of vaccination, but also medium high level of cases. You can kind of put these together, and this was done a couple of weeks ago, but you can see that we have pretty high levels of immunity. A lot of this along the southern border is naturally acquired. Here in the Los Angeles and the Southeast, which is the kind of Inland Empire part, it's well into the 60s. Up the coast, it's in the 60s. In the Bay Area, where we've had fewer cases, but have a lot better job, done a lot better job, it's probably by now into the low 70s. And it only remains up here in the northern tier, where there was not a lot of disease outside of Lassen County and Tehama County here. But there's also a lot of under-immunization, with the exception kind of Humboldt County here, that you end up with there being probably substantial pockets of people lacking immunity. Now, variants continue to be a concern. These are U.S. data for the last four. This is for the 4 weeks ending, for the period May 9 to May 22. And you can see how the alpha variant, the B117 variant, has become the predominant lineage over this last 14-day period, where it accounts for almost 70% of all genotyped isolates in the US. The P1, which we now call Gamma, this is the one from Brazil, is about 8% overall. These are the New York variants, which have all sorts of funny names. This is the Delta variant, which we are so concerned about, as 2.5%. And then these are all other kind of background ones. The California variants, which became the West Coast variants, which became B1427, 1429, which are now referred to collectively as Epsilon variant, have very little penetrance anymore. It's around 1%. But here in California, for the 4-week period ending May 22, these are CDC data. The Alpha variant, 58%. The Gamma variant, 9.5%, which we don't talk a lot about. This is the old South African one that's very low. The West Coast variant, which was so prominent, I'll show you in a second, has really fallen way off the map. And then the Delta variant is starting to come up. And I've seen some projections that would suggest that this would get to as high as possibly 70% or more by the end of the summer. This just gives you an idea of how this has gone up. The dark blue down here, the sky blue, whatever color blue this is the Alpha variant, the UK variant, the B117, all the same thing. These are the California variants. See how prominent they were, but they've really kind of disappeared over time. These are the two Brazilian variants here. And I think the interesting thing to see is how we're starting to see the emergence of the Delta variant. And the guess is that this will increase proportionately, substantially over time, because it outcompetes the Alpha and all the other variants in terms of transmissibility. Now, so that's all the worrisome stuff. The good news is that these are, the British have been doing very careful looks at how well the Pfizer vaccine, an mRNA vaccine, does against the Delta variant. And they estimate vaccine effectiveness against hospitalization as 94% after 1 dose and 96% after 2 doses. For the AstraZeneca vaccine, which they've used a lot of, about 70%, 71% after 1 dose and 92% after 2 doses. So the bottom line is sort of variant schmariant. This is, as far as we can tell, the current vaccines that we're using perform perfectly well against the Delta variant. Now, so into every life a little rain must fall. So there is a problem with the mRNA vaccines that has emerged. There have been 475 reports of myocarditis and pericarditis, which have been temporarily associated with mRNA vaccine in the U.S. in people under 30 years of age. Of these 475 cases, 226 have met the CDC case definition. Most of these are in young adults and adolescent males from 16 to 29 years old. These typically follow after the second dose rather than the first dose and appear within, say, 4 days after COVID vaccination. And so the CDC ran down 236, a slightly different denominator, and had 180 that of the 76% of the 236 that had been fully investigated who had known status, and the 76% had fully recovered without symptoms, and 15 remained hospitalized. CDC continues to recommend COVID-19 vaccination for everyone 12 years old and older, given the greater risk of COVID-19 illness and related possibly severe complications. And ACIP is meeting tomorrow to review this and make further recommendations, so stay tuned. This just shows you a little bit more data between expected and the actual observed numbers of cases. So out of 8.8% of all doses administered in these age ranges, 52.5% of all the case reports of myocarditis have occurred in this group. Sorry, these numbers jump around because there's case definitions on and off. And then finally, on Tuesday, we reopened. There continue to be mask mandates for unvaccinated people and mask mandates for vaccinated people in certain settings. And Cal OSHA is meeting today, hopefully to bring into alignment the workplace rules with the other rules. The governor said he will waive the 2-week period, and he'll do it all by executive order if the Cal OSHA board adopts these today. So the final question is it over? And the answer is no, it's not over. There's lower vaccination coverage in some areas, coupled with more transmissible variants, will likely mean small clusters of disease will persist. However, at some point this summer, we'll achieve herd immunity, at least regionally, if not statewide. And then finally, I want to come back to the question about, well, what about the schools? So I can tell you as a pediatrician, schools are hugely important in the socialization of kids, and not only in their academic achievement, obviously, and they can and should be reopened. I would suggest that teachers, eligible students, and family members should be vaccinated to prevent home and school transmission to younger children. Younger children are infected by adults. So whether additional mitigation is needed should depend on the levels of immunity, natural plus vaccine acquired in the population, and herd immunity will protect school-age children too. So thanks again. Thanks for the opportunity to talk to everyone, Bob, and happy to answer any questions if we have time.
Thanks, George. Fantastic. We only have a minute or two, so let me just quickly throw one or two. This idea of whether Delta is vaccine resistant at all, the ultimate numbers of efficacy of Pfizer and Moderna appear to be great, but the first dose efficacy is lower. So there's something about it that at least partly evades the vaccine. Is that meaningful? Does it mean that people whose immunity came from a prior infection are at more risk of getting Delta, or how do you interpret those data?
No, I don't think so. Really, I mean, it's first of all, that's the AstraZeneca vaccine. The Pfizer vaccine was pretty good across the board with both first and second doses. A naturally acquired immunity stimulates lots of things as well, and I think that my reading of the tea leaves here is that people with naturally acquired immunity are just as immune as people with vaccine acquired immunity. Whether it'll last as long, I assume so, but I don't know that as a fact yet.
Okay. And last question for you would be, what are you doing now? I went to the Safeway yesterday and there were people there without masks, which I hadn't seen before. Do you feel comfortable going indoors without masks? Are you going to restaurants indoors?
Yeah, absolutely. I am. Yeah. We went to dinner on Tuesday night to celebrate, and the restaurant was like, well, what are we supposed to do now?
Yeah, right. How about going to a store?
Yeah, I do that. I mean, if we're at some wheezy old movie theater with, it's completely packed with people who look like they might not be vaccinated, that might cause me to put on a mask. But I think it'd be a pretty unusual circumstance.
Great. All right. Thanks, George. Really appreciate it. Let us go ahead and bring on Andy. And I'll do an introduction real quick, but I think people, if they've been following anything, they know who Andy Slavitt is. But Andy was President Biden's White House advisor for COVID until 2 weeks ago. He's led many of the nation's most important health initiatives with a particular focus on leading the implementation of the ACA. He also ran Medicare and Medicaid for several years under President Obama. He is founder of United States of Care, a national nonprofit health advocacy organization, founding partner of Town Hall Ventures, a healthcare firm that invests in underrepresented communities. He has resumed, after this imposter stood in for him for 4 months, he's resumed his rightful place as host of the popular COVID-themed podcast In the Bubble. And his new book, there you go. It's called Preventable, and it is absolutely fantastic. I read it this weekend, was published by St. Martin's Press this week. So Andy, welcome to you. I'm thrilled that you could join us today. Thank you. You're on mute. Let's see if there you go.
Here you go.
Yeah.
How's that?
Fantastic.
That's a sign that the pandemic isn't completely over because I haven't figured out the mute button.
You'll get it eventually. I mean, I see you change back to your old pre-administration clothing. That's nice. So we're just going to chat for a little bit. Let me start with the obvious and most important question. We have a lot to cover, so make this effusive since my colleagues are watching and my mother will watch tonight, but make it short. Go ahead and talk about my tenure as substitute host of In the Bubble.
Well, the fans loved you. And in fact,
both of them?
I told the story, but I went for dinner with some friends in Minnesota when we were back there for the weekend. And she's a big fan of the podcast, and her husband's kind of, not so much. And he says, over the last few months, the podcast has gotten really great. And I said, he goes, yeah, this Dr. Bob is great. I learned so much. And I'm like, oh, so you like him better than me, huh? And he goes, well, he's more my style. I like him better. Just like, okay, I guess that's good.
Yeah.
But I'm sure that's not an uncommon reaction. I think people are really going to miss you. And I'm really grateful to you. You did such a wonderful job, as you always do, just communicating to people about the issues that matter and bringing facts and love. I mean, you're a little short on the humor side.
It's a big problem.
By my grading, but otherwise you were great.
Thank you. Enough said. You and Andy is back hosting it. The first episode of the new In the Bubble landed yesterday. It's wonderful, and I really recommend it to everybody. Let's start with the news of the day. You were a key player in the implementation of the ACA and rescuing the federal website as well. What is the Supreme Court ruling today upholding the ACA? What does that mean to you?
Well, I think it probably ends the 10-year journey by, I'm just call it what it is without sounding political, by the Republican Party, by Donald Trump, to try to take away pre-existing condition protection and run this kind of rampant fight. And for, I think, Americans who want pre-existing condition protections, which is most people, can breathe easier. You also have to step back and ask yourself the question. The court found that the plaintiffs didn't even have standing, meaning they weren't being harmed in any way by the law. Just kind of ask yourself, why would what's motivating people to want to take away people's health insurance coverage and pre-existing condition protections if it doesn't even hurt them? I just think that's something we ought to ponder when considering the notion that I generally tend to have, which is that everyone means well. We may have disagreements. I'm not so sure I believe that here.
Yeah. Well, it's going to be a little bit of a theme. It's a theme of the book as well in terms of what has happened to our society, not just our politics. And we'll get to that in a second. Let's spend a minute talking about you. And one looks at your CV and sees a Wharton degree, a Harvard MBA, McKinsey, Goldman Sachs, United Healthcare. So you have the pedigree of a profit maximizing capitalist. And yet when you look at the last 10 years of your life, you sort of look like an MPH and a community organizer. So what happened to you and what explains, I think, a pretty unique career path in terms of the things you focused on, particularly for the last decade?
Fair to say, probably a product of the 80s, probably a product of someone who grew up in a family that didn't have any money. And I was an English major in college at Penn, like you, but got there and also became a finance major at Wharton. And if I could do any amount of science, I probably would have been a doctor, but that's not the case. I really wanted to be a journalist. I think my lifelong dream was to be a journalist. And so, I ended up taking the course of least resistance. I took the job out of school that I asked someone what the most competitive job to get was, and they told me Goldman Sachs, and I went and worked there. I asked what the best business school was and went to that one. So I think there was a period of time in my 20s where I wasn't quite sure what I wanted to do, but I figured go where the smarter people are, get good training, and then you'll figure it out. And then when I was 31, everything changed. When my roommate from college, who I talk about in the book, Jeff Yurkovsky, we were both 31, started experiencing numbness in his arm, which we found out a couple of days later was a brain tumor, and he died 5 months later. And that actually is what threw me off of this sort of very boring MBA career path into something of substance. And it's led to a journey from many directions of trying to figure out how to make the healthcare system work better for real people. And that sort of was the trigger.
Great. Well, it's terrible that it happened, but the contribution you've been able to make has been really inspiring. Before we get to COVID, speaking of profit maximizing, although the book's mostly about COVID, there's actually a chapter or two that are pretty powerful indictments of the healthcare system. And one striking segment, you talk about how it's really this great financial engine for certain categories of industries, with patients sort of almost incidentally in the middle. And here's the line that stuck with me. I can't remember, this is when you were running CMS. So you're running whatever, a third of the healthcare system. I can't remember a single time when anyone in the healthcare system made an urgent call or came to see me because of something involving a patient. It was always about money. Talk about that.
Yes. Well, look, I think it's hard to explain our healthcare system to people not from this country. You need a pen, a diagram, arrows, and inevitably end up writing dollar figures everywhere. And it strikes me that all of us are a victim of that. Great scientists, great clinicians, otherwise, because for most of us, that's not why we're here, but it's what makes this business go round. And we have created more industries. We've got a multi-billion-dollar EHR industry, and we all think EHRs suck. Yet we've got a multi-billion-dollar EHR industry. We've got a multi-billion-dollar collections industry. We've got a multi-billion-dollar PBM industry. We've got multi-billion-dollar industries everywhere that never touch patients and have companies with massive market caps. And so when something comes along that threatens patient care or threatens people's revenues and profits, sadly, people aren't willing to compromise when it comes to their bottom line, whereas they will then say, "Well, do the best we can with the patient side," and it's really something that during the pandemic, there's several examples where insurance companies said, "Hey, we're getting all this money and nobody's going to the hospital." And the doctor, we're sitting here with all of this money, but it affects everything we do. I mean, we research cancer drugs because we can charge lots of money for cancer drugs, and that's what the pharmaceutical industry does. But you take something like antibiotics, where we've got all these antibiotic resistant infections right now, but the reimbursement's so much lower, so our researchers don't try to solve those problems. So a lot of things came to light during the pandemic that I thought were worth pointing out, and doing this sort of view of what the whole chapter is called the folly of the free market pandemic, which is the president didn't want to do anything that would get in anybody's way of making money, because as if he believed that if the stock market went up, even if people were dying, that was his best chance to get reelected.
Yeah. So before we sort of turn the laser to COVID, I want to spend one more second on the healthcare system and that indictment. One could argue there'd be no one in a better position to change that system than someone running CMS. So, and running, basically in charge of all of the government programs that fund healthcare. And obviously, you were able to make some strides, but obviously it's stickier than what any of us would hope. So what are the prospects of changing any of it, and why, in the position you were in, what makes it so hard to change the status quo?
If I have one complaint about the healthcare system, it's not the care that I get or the care that you probably get. We may complain that it's expensive. We may be complaining that it's uncoordinated. We complain about all the ways it's not perfect. But the big issue is that most people don't get the care that you and I get in the system. If you live in the wrong zip code, if you're Black or brown, if you live in a rural community, if your income or job is different, your life expectancy at birth is 10 years shorter. And everything about your experience with the healthcare system is worse. And it's not just because of the healthcare system, which is why this is a much more interesting and entrenched problem. It's because of multi-generational poverty. It's because of lack of access to resources. It's because of structural racism. It's because of a lot of things. But when I talk about my standard stump speech in healthcare is looking at a crowd of generally well-off people, and I give this speech about there's two types of people that experience the healthcare system: the Peloton crowd and the take the bus crowd. If you've never taken the bus, you're in the Peloton crowd. If you take the bus on a regular basis, and then I'd basically describe the difference in the healthcare experience at an anatomical level that you get. I'll go ranging all the way from the way you get treated in dialysis to to every other element of your care. And there's just no arguing that that's something that's broken about our society. And we need to fix that. And our healthcare system is a big part of it.
Okay. Let us turn to COVID. I'm sure you're sick of this question. Let's start with, what is Fauci like?
Real jerk.
He's a jerk. Yeah. That was my sense as well. Yeah.
Yeah. I mean, don't let his nice guy stuff. No, he called it. So I was due to leave June 8th, and he called this emergency call June 2nd for Rochelle, myself, him, and a few other people. And I don't know what it's about, but he rarely puts a call up on the calendar. And I get on, and he proceeds to play the song "Won't You Stay a Little Bit Longer," and does this whole gag. So he's a thoughtful, sweet, humble person who is a lot smarter than Rand Paul, I would say, by every measure. And I think most of the people on this call know that if he wasn't working for the last 2 decades on the mRNA platform and didn't jump on the genetic sequence on January 11th and outlined how in the book, on January 13th, he sent that sequence off to Moderna, we would be in a potentially different place right now. So I love all of these critics who are like, fire Fauci, when I'm like, okay, what would you have been doing on January 11th, Rand Paul? Mm-hmm. Would you have fired Fauci, and would you have had the foresight to do that? For the last 2 decades, were you investing in the mRNA platform? So to some extent, on both sides of the aisle, politicians are probably the last people we should be listening to in a public health crisis, except the ones that are going to deal with it responsibly. And we ought to let the experts be experts. And we tried to do that during the Biden administration as much as anything else that was important to us.
Yeah. So when you got to DC this time, you talk in the book about the lack of a transition, how the Trump administration did everything they could not to help you. So what did you find there, and what did you and the team decide were your key principles you were going to operate under?
As I think about it, now that I have just a tiny bit of distance, but I had to put it on one thing, it's as simple as that President Biden took accountability for the crisis. And that was the biggest change, because every decision that was getting made with a way to say, if something doesn't go wrong, we can't let President Trump get blamed. It's got to be the states. We could blame China. We could blame the blue states. We could blame anybody. But and as a result of that, he never took on the most important tasks to get done. And President Biden said, we're not going to fight with governors. We're not going to get distracted. We're not going to overpromise. We're not going to dress this thing up to look prettier than it is. And then in the preface, there's a scene where he tells me in the Oval, Andy, I don't want you making me look good. I want you telling the public what they need to hear. So that little thing alone, think about how much easier my job was than Debbie Birx's. I mean, Debbie Birx had to spend 80% of her energy trying to perform for her boss in order to just do a small element of her job. I was given the luxury of saying, go tell the public what it is that's most helpful. And everything, I think, falls from that, Bob. I think, getting people with experience and to know how to execute, people who are used to taking accountability, people who are operational, people who are good team players. Those are all, once you decide to take accountability and you do those things, and the president and bringing in Ron Klain and Jeff Zients and others, I thought were all the right moves.
Yeah. It seems like you were far more willing to acknowledge uncertainty, to say we got this wrong, to underpromise and overdeliver. It seemed like those were all sort of baked into, it flowed from the accountability.
The thing that got the biggest reaction to, Bob, was what felt like the most minor of things. But I was leading a press conference, and someone asked a question about people being unable to get an appointment and the website and computer, et cetera. And I said, look, let me just be very clear. We have a shortage of vaccines. We're going to have a shortage for weeks, if not a couple of months. We are not used to, as Americans, not getting what we want when we want. So this is very uncomfortable. But it will be over, and we will have an abundance of vaccines in some period of time. And I got more response to that. I got a note. I remember one note I got from a nurse who said, I've been volunteering through this pandemic, and if today we all looked at ourselves and said, this is the first time someone's acknowledged the truth, and we feel more optimistic, and took a deep breath because we felt like people are seeing the same thing we're seeing, and they're going to tell us the truth. And she said she went home and told her husband that this is going to get solved, which I thought was hilarious, because we were essentially saying that we're not close to having it solved just yet.
Yeah, but it's the disconnect between your lived reality and what you're hearing, and the BS detector goes off, and that's just an uncomfortable place. You treated people like adults. Let's talk about some of the tough calls you made. One that we went a little back and forth on was delayed second dose. So what was that like to kind of grapple with it? I mean, everybody there around the table is really smart and could see the arguments for it and against it, and you ultimately decided to stick with the plan. How did that happen, and who was ultimately the decision maker? It can't be made by a committee. I assume there's somebody who ultimately says, we're not doing this.
So it was interesting, Bob, because Mike Osterholm was the first one I remember saying it publicly. And, the first time someone says, hey, do something different than what you're doing, than what your plan is, there's an immediate impulse to get a little bit defensive and try to justify. But what we did is we basically said, Fauci, Walensky, Bashara Kosher, Nunez Smith, like 4 or 5 of the kind of key clinicians, scientists and clinicians only. We basically said, go review this and see what you think. And I remember having a conversation with Fauci, because he was the one that was biggest proponent of the two, where I said, go into that conversation and see if you can make the other side of the argument, because I didn't want him to be too wedded to that position. And they did it. They came back and they said, everyone's saying 1, we still think 2. And we essentially decided whatever they came back with, if they could reach a consensus, we were going to go with it, no matter what, because there's nobody in the White House that had any kind of authority over this and any kind of reason to know more. But what Fauci's principal point was, with these variants, we're going to need, what 1 dose is likely not going to be enough with some of these variants. And so we're going to need the extra boost. And so that was their part of it. I think there was another element, Bob, though, too, which is that I was also betting on our ability to execute. I thought we could have our cake and eat it too. I felt like even though we were in a shortage situation, that shortage, we were going to work through it fast because I was betting that our additional vaccinators and production capabilities and efficiencies and so forth, we're going to get people vaccinated more quickly. And as always in these situations, you're going to take some criticism. You're not going to, it's inescapable. But if you're accountable for the decision, you're in a position where you have to think through the consequence of getting it wrong. And, as I've criticized from the outside, I've never had to live with the idea of getting it wrong. But for my token, we sent that group back 3 times after 3 different occasions to just revisit. And all 3 times they came back with the same answer. And as far as I was concerned, we were going to support whatever they came back with.
Yeah. Another thing that struck me, you had this interesting play of time where early on it was all about operations and production and distribution and getting it out there and sort of, supply chain 101 in a way. And you knew at some point it would toggle to be getting people to want to take the vaccine. As you thought about that problem, which obviously is the dominant problem now, I assume you have access to the world's greatest experts on how do you get people to do stuff they may not want to do. And is it going to be a TikTok, video with somebody on a skateboard? Is it going to be incentives? Is it going to be penalties and passports? So what did you learn about the process of trying to get people to take a vaccine, and how did it influence your thinking, your policy?
So you're right. We sat down even at the beginning, even as we were solving the supply chain problem, we sat down with behavioral economists. We sat down and met with all the researchers, and we sat down with pollsters, and we listened. And the dominant kind of perspectives at the beginning turned out not to be quite right. One was that it would be people of color that would be most resistant. And the other was that we needed to run a big, giant marketing campaign to persuade people to get vaccinated. And it turned out that it wasn't people of color, but actually young people. And secondarily, in addition, it wasn't just young people. It's also based on college, non-college. It's actually not political party, believe it or not. It's college, non-college. And if you're over 40 right now, 75% of people are vaccinated. If you're under 40, it's still less than half. And that started to emerge. And then what also started to emerge is the question that I wanted to keep asking is, who do people trust? Because my view was that the evidence from the vaccines was either going to be great or was going to not be great. But if the evidence was great, then we got to get that great information into the hands of people who people will seek out and want their opinions of. And the whole battle is to have them go there instead of Facebook. And the there turns out to be my doctor. The there always turns out to be someone local. Mm-hmm. It's not Dr. Fauci. It's not Donald Trump. It's not, Jay-Z. It's my doctor, maybe my pharmacist, maybe my clergy. And we had about 40% of people when we got there who said they would definitely take the vaccine. It felt to me like we would get a domino effect from getting the first kind of 100 million people vaccinated. We would get more people to come. And, ultimately getting to the place where we've gotten to with adults, I think is pretty good. I think there are some people that this is just a more considered decision. They're not anti-vaccine, but they have questions that they want answered, and we need to treat those questions as legitimate. I know we want to say, hey, but if you do this, we'll get to herd immunity. Unfortunately, that's not persuasive.
Yeah.
To put something in your body, these people want to get questions answered. And some of those questions will get answered when the FDA does final approval. Some of them will get answered a little bit more over time. Eventually, I think it's going to be very commonplace to take the vaccine. But it's understandable that for some people, it's a different decision because in their minds, it's brand new, or in their minds, certain questions aren't answered. And that's very fair. And we have to be respectful of that process, I think.
So let's turn to the People magazine portion of our talk, where I throw out names of characters in your book and you tell us what you think about them. You were very open and honest in the book, so I assume you can be in this forum as well. Let's start with Trump.
Yeah. Trump committed 3 deadly sins. Mismanagement to me is not a sin, by the way. Managing a pandemic is hard. Making perfect decisions is impossible. Number one, he denied this, his power to deny and try to repaint the world to look like he wants it to look, was very destructive. If he'd have simply said, hey, we have a problem and it's hard, but he would have said that early as soon as he knew. Instead, we know from Bob Woodward's reporting that he went to bed every night starting in January, essentially knowing full well that many Americans were going to die and apparently not bothering him enough to say anything. If it hadn't been for the NBA coming crashing down, which then triggered the stock market coming down, who knows when the president would have acknowledged the virus. Yeah. The second sin, and it's a big one, is quashing any dissenting voices. There's a part of the book where Alex Azar, who you can ask me about as well, who was the health secretary, wanted to go on to Fox and Friends and simply say things are fine, which they weren't, but he was going to add the phrase, but things could change rapidly. He not only got pulled from Fox and Friends, he was banned from doing all media for 45 days. So picture this, we have a pandemic and our own Department of Health and Human Services can't talk to the public or the press for 45 days. And that was consistent thread throughout, whether it was Deborah Birx, Tony Fauci, Nancy Messonnier. If anybody, the FDA, if anybody had an opinion counter to Trump's narrative, which is that this thing is overblown, they were cast out and refrained. And you cannot manage a pandemic that way. And the third deadly sin is, on top of all of this, for extra credit, he decided to politicize it all. He decided to prey on our divisions. Once he saw that people were not liking mask wearing, remember, he's a populist. Populists don't create these ideas. Populists are good at sensing the crowd and playing to the crowd. And so the day after he allowed Deborah Birx to roll out her plan about what it would take to open up states, he sent two tweets, one that said liberate Minnesota, one that said liberate Michigan. Having a populist, having someone try to be popular and play to the crowd while managing a pandemic, also not a great combination. Yeah. So those three things showed just how ill-suited he was to lead us through this, in my view.
Yeah. Scott Atlas.
Scott Atlas is almost a Frankenstein monster. And what I mean by that is he is their creation. I had a conversation, I was part of a conversation with Reince Priebus, who had just come from the White House in the spring. And he said, the answer to all these pointy-headed experts is we need our own experts from Harvard or Stanford or Yale to get on TV and say, this thing ain't that bad. Because once we're going to play to the cable TV's penchant for there's two sides of every issue, and all we need is one. Mm-hmm. Now, the truth is, it took them months to find someone, and they couldn't even find someone who was an epidemiologist. But they basically found someone who was willing to say what the president believed. So it has nothing to do with Scott Atlas. Scott Atlas just was willing.
Yeah. Scott
Atlas was willing to come in and say and do those things. Now he's got his own book coming out where I'm sure he's going to talk about, well, I don't know what he's going to talk about, but there's very few people in the book that are all good or all bad. I think Scott Atlas is harder to see the good.
Yeah. Yeah. And you would not, just make clear, recommend that people read your book and then his book to get a fair and balanced view of the pandemic.
Well, he's got this thing advertised. He hasn't gotten it written yet. I don't know what he's going to write.
He's going to will it to be so. Right. A couple of people that have more nuanced, they come out in a more nuanced way in your view, or at least my reading of your view. One is Debbie Birx. So talk about her for a sec.
Yeah, I mean, the arc of Debbie Birx gets handed this assignment. She's clearly qualified. She means well. She believes at the beginning that she's going to be given the mantle to do this. She's getting the groupthink from the White House, which is that this thing ain't that bad. And a combination of seeing the kind of decline we saw in the spring, she thought we were legit. She thought we were going to go down Italy's curve. And so she became way too rosy, way too positive, probably a little too infatuated with kind of briefing the president. But she also thought that the plan she was going to roll out, the plan that she did roll out, which said, here's the gates required to open up your states, that she got Trump to endorse that. Now, as the book shows, she presented that to Trump in the morning of the press conference, and he never really looked at it. So the two of them went up and did a press conference where they each thought they were doing different things. She thought she was giving out a map to open up the country. He was basically ending the pandemic. And when she found that out, became disheartened and tried to speak out, she got kicked off the team.
Yeah.
And so the rest of the book, she is spending her time essentially on a pilgrimage around the country, trying to share data with governors and in a sense redeem herself. And the sort of ultimate scene in the book, because it's written very much to these sort of characters, is she and I in a room together a week before the election, with me trying to suss out where she stood and her being making it very clear where she stood. So for everybody who doesn't like Debbie Birx, it's largely because they hadn't yet met Scott Atlas.
Yeah, I guess. But I guess it left me wondering, how did you could imagine both she and Fauci started the year in the same place, had this impossible boss, had to try to please him, did not want to get kicked off the team, maybe thought the greater good was staying on the team. And Fauci managed to navigate it. She did not. What was the difference there?
She took an office in the White House. She relished her proximity to power, and Tony didn't. Mm-hmm. Tony just essentially kept. Look, they both had something very difficult to navigate. Yeah. But he was willing to give up his relationship with the president. He was trying hard not to antagonize him. He didn't want to get fired, but he was doing the best he could, and was going about as far as he could without, trying to blatantly take on Trump. And look, when I talked to him, he's very complimentary about some of the things and some of the people in the Trump administration who were actually trying to do things. So, but Birx was in a different spot, and it's very, when you sit in the Situation Room with the vice president and you brief him and and she wanted to give him good news, and I think she made some errors, whether they're errors in judgment or whether they were clouded by other things. Most of the time, she was fighting against the economists and the National Economic Council. Most of the time, she was trying, I think, to pull things in the right direction, and it was a losing battle. Yeah.
All right, let's spend a few minutes sort of going back to a wider lens of what the meaning of this year has been and what you learned, what the important lessons are for us. I come away from it. It's a powerful indictment of Trump, but it's actually in some ways more powerful indictment of all of us and our society and what we've become. So if that's the issue, does getting rid of him change anything? Or do you think the fundamental problems really are fundamental and have to be addressed outside of who the leader happens to be?
Yeah, I mean, look, so first of all, on Trump, let's just take this out of the realm of politics. I think a Mitt Romney presidency or a George W. Bush presidency, we would have had a very solid and different response. This is about Trump as a populist, about Trump and his ego. It's not about Democrats versus Republicans, and I'd like to think it wouldn't have been. I think in any of those administrations, someone like Scott Gottlieb or Mark McClellan, and people like them would have been very competently running the response. So it tells us a little bit about what kind of leader we want to have. But you're exactly right, Bob. There's other lessons that emerge. And if we just think about this as Trump, we're probably missing a couple of points. So one is, why are we so quick to cast out experts, particularly in a crisis where you need to rely on experts because what you see with your naked eye it will mislead you because you can't see exponential growth and you can't see asymptomatic spread. So why are we so quick to discount experts? Secondly,
let me just add, Andy. You say discount experts. You also make the point that we then also elevate non-experts into positions of great authority.
Well, I think that may be the answer. Yeah. I think that may be the answer. Is if you're Tucker Carlson and you can catch Tony Fauci being wrong, it validates you as being smarter than Tony Fauci without any training. And I think with social media and a platform. Two thumbs and an opinion, and guess what? You're as smart as Tony Fauci. So we fell prey to that too easily. Second is it's just sort of undeniable how inequality and race and the structure of our jobs impacted things. We had to define 70% of Americans as essential workers in many cases, and so people in the 30% who are home safely at home, in luxury, not going out, wearing a mask on Zoom, getting Amazon deliveries. We're like, I don't even know many of the people that are dying. Meanwhile, if you lived in East Los Angeles or you lived in Oakland, it was happening all around you everywhere. But, and so I know there was one part of the book where someone says to me, Andy, I don't know anybody that's died from COVID. And it was kind of an accusatory thing.
Mm-hmm.
And part of my response was, well, you've never been to Albania, but it still exists. But what I said was, you do know the people that are dying from COVID. You might not know their names, but you know them because they're the people that grow your food for you. They're the people that deliver it to the plant. They're people in meatpacking plants. They're people who are working in your grocery store. They're people who are delivering food to your homes. Those are the people that are getting sick and dying. And in a different society, you might know their names, but just because you don't, you need to understand that they work for you. And that kind of ability for well-off people to separate ourselves, people with privilege, and isolate themselves from suffering. As soon as people felt safe, as soon as people felt like, well, I'm a white, comfortable person, I'm not as at risk. It did change people's behavior, or at least that's one of the things that's suggested, in the book. And then our healthcare system, which you already talked about,
yeah.
Which is, we were unwilling, and oftentimes to make the decisions that were in our own best interest, unless there was a lot of money attached to it, and that's just something we got ourselves into. So my sense is solving this for the next time isn't about like buying a bunch of masks and a bunch of ventilators so we're quote unquote ready next time. It's also about a dialogue about what kind of country we want to be. And further to that, like if we wait to the next pandemic to solve these problems, I think we've missed kind of the point. I mean, so many people learned for the first time about how many children couldn't get lunches unless they were at school. That was happening before the pandemic. That happened during the pandemic. And if we let it, it's going to happen after the pandemic. Same kids don't have internet at home. We're going to let that happen coming out of this. Then it's in my mind, that is a bit of a failure in our response, if that's what happens.
Yeah. I'd say I finished the book, part of me uplifted, part of me depressed. And I think about one of the themes of the Biden administration is to prove that democracy works. And I think you'd have a hard time looking at the last 18 months and say, we've proved that. We've actually proved that in many ways it doesn't. And I think you make the point that this was a starter bug, that we'll see worse bugs, but it's also a starter for climate change, a starter for gun control, a starter for big, hairy problems that affects many people more than other people and require some sacrifice. And I think we've proved that we stink at that. So, and you laid out in the last couple of pages, well, we could go this way or that way. And I found your argument about why we might go in the wrong direction a little more persuasive. So do you come out of this a little optimistic, very optimistic, or more pessimistic?
I come out of this feeling like if we don't do the work, we're going to head the wrong direction. And it's easy enough not to do the work because the most powerful people in the country, the people that would have to change, would be people that have to give things up, and were people that were not the most affected by this. I don't use this analogy in the book, but one of the analogies I might use is it's like the crack epidemic and the opioid epidemic. The crack epidemic was a drug problem by bad people who were abusing drugs, and it was criminal. The opioid problem, now that's different. That's a problem of addiction and recovery, and that's our problem. Because one thing, largely in people's narratives, happened in the cities with people of color, and the other happened to all of us. Mm-hmm. And so, if you come away from the pandemic thinking, you know what, this whole thing was kind of overblown. I was never really a threat. Maybe this hit some other people, but they were older or whatever they were. Then you'll take one lesson out of this. If you come out of this saying something happened to us as a country, and it hurt all of us, and if people in my community died needlessly, then that's something that I should be feeling bad about. And I don't think it's clear which way people come out, which is why I left it, why I created this wishbone, mm-hmm. which said, we will need to do the work to go down this course. I am confident that when we do the work, this country can do anything. And that is, to your point, one of the things that President Biden said over and over, and we wanted to demonstrate, is we need to show this country that we could go from worst to first. He didn't say it in those terms, but those are the terms that that felt it, because our sense of ourselves is almost like we are overly confident that we're good at things we've never done, and therefore we don't have to get good at the hard things. And look, that's just a dialogue. That may not be everybody's point of view, but I think the book tries to raise the questions that let's not just throw this on one political figure. Let's also look at some of the other things we've learned about ourselves.
Yeah, the striking lack of empathy is maybe first among them. Well, I should let you go. I should let our audience go. I got used to, while I was on the show, learning to sell things. So the book is really terrific if people have a chance to go out and buy it and read it, and Andy's podcast. It's taken a step down or so since over the last few months, but he'll probably get back to the hang of it. So thank you for being with us, and thank you.
If you really want to sell it, you'd say that if you buy it by Saturday, that will increase Andy's chances of getting in the New York Times bestseller list, which will save his wife from listening to him whine continuously, because he's such a vain, insecure author writing his first book.
Yeah. She told me all that. I wrote a book 5 years ago that made it onto the bestseller list for 1 hour, and I took a screenshot, and that was like, I'm done.
You're a New York Times best-selling author. Period.
That's it.
Only has to happen for an hour.
In your bio forever.
Exactly.
Well, Andy, thanks. Seriously, everything you have done has been. I've learned a ton from you, and we owe you a debt of gratitude for what you've done for all of us, for the country. You've saved a lot of lives and helped us get through a really tough last 18 months. Obviously not over yet, but thank you for everything you've done and everything you will do. Really appreciate it.
Thank you for inviting me to this, and it's such a pleasure, Bob.
Thank you. All right, folks, thank you for joining us. And as I said, we'll be back next week with the last of our regular grand rounds. That'll be on climate change, speaking of tough issues, and the health effects. And then we will plan on taking July and August off and come back with more grand rounds, including as appropriate COVID themed beginning right after Labor Day. So stay safe until then, and be well. And if you're not vaccinated yet, please do. Thanks so much.